Good evening, everyone. My name is Debbie Stamps, and I'm your DEI consultant partnering with the Board of Directors and the DEI Committee here at the ANNA. We have developed a strategic plan regarding our diversity, equity, and inclusion that aligns with the ANNA's 2023-2025 strategic plan. This strategic plan has led to the priority to expand knowledge to all of our members, our organization management, leadership, and the board of directors. Over the next few months, we will offer DEI continuing nursing education on the topic of various topics of diversity, equity, and inclusion. We are really pleased this evening that we have our first module that will be presented by Dr. Ebony Caldwell. We have for you this education offering, and then there will be time for questions at the end. Please use the Q&A feature in the Zoom, and we will address questions following the end of the presentation. Your contact hour evaluation will be located in the ANA online library event page. So please complete that evaluation and receive your contact hours. Well, without further ado, it is my pleasure to introduce to you Dr. Ebony Caldwell. Dr. Caldwell is the System Director for Diversity, Equity, and Inclusion at Rochester Regional Health. She is a transformative leader that has dedicated over a decade of her career to organizational change and strategic planning with an intentional focus on diversity, equity, and inclusion. Her career includes work in law enforcement, politics, academia, community, and consulting. Dr. Caldwell engages in critical conversations to examine, uncover, and address historic and structural inequities. She works from the philosophy of diversity is a benefit, equity is a goal, and inclusion is an ongoing practice. She has led cross-divisional committees, task force, and leadership advisory boards to align commitment, vision, and results. In this work, she has cultivated the ability to garner the support of colleagues and embrace the gray areas as opportunities for growth. Dr. Caldwell received her bachelor's and master's degree in psychology from Medaille University and a doctorate in executive leadership from St. John Fisher University. Please welcome Dr. Ebony Caldwell, and I'll turn it over to her. Thank you.
Thank you so much, Dr. Stamps. And thank you all for being here with us this evening. So happy to be a part of this work. I want to thank Dr. Stamps for kind words and the many collaborations that we've done together to move this work forward. So today or tonight, this evening, we're going to focus on foundations of diversity, equity, and inclusion. And that means defining a common language that will help us discuss and promote diversity, equity, and inclusion initiatives. These objectives will be for all of the modules. And so tonight we'll focus on objective 1, but the other objectives are to discuss bias and racism to understand its impact on healthcare. We want to also identify concepts and strategies to help mitigate and eradicate disparities. And then finally, we want to develop a toolbox for our leaders so that we can help address and foster a culture of allyship. So this evening, we've already done our welcomes. We're going to do a little bit of an introduction. And then we're going to start with our common language, critical concepts. We're going to talk about these acronyms, REAL and SOGI. What do they mean and what do we use them for? We're also going to talk about the importance of pronouns, and then we're going to summarize what we talked about here today and how not only can we learn, but how can we apply this to the work that we do every day. And then we'll take as many questions as possible. So first, we want to start with a little icebreaker. So if you would take a minute to indulge me in participating with this icebreaker this evening, take a minute to think about and do some self-reflection. If you've done or filled in the pre-work wheels, then it may help you. If not, you can still do a quick reflection now. Take a little bit of time to answer the question in 1 to 3 words. Who am I? I would bet a lot of you would probably say I'm a nurse, but we want you to dig a little bit deeper. Think about the complexity of your identity and then share your background and beliefs in 1 to 3 words. Put it in the chat, let the chat populate, and we'll refer back to this in a few slides. So we're going to start with common language and critical concepts. Language is a basic imperative for effective communication, and shared or common language is even more important when engaging in DEI work and learning and leaning into our efforts to affirm all cultures and identities. So we start with the most of our presentations, we like to start with, or I like to start with, our foundational terms. Not that you haven't seen these words before, but we all need to be working from the same frame of reference. And so most of these definitions are taken from the ANNA glossary. So diversity is a very broad concept. It's the mere presence of difference. It's in the room, whether we can see it or whether we can't. And it's about seeing, accepting, respecting unique differences. These differences are driven by our many dimensions of our identity. So dimensions of diversity is like an iceberg. There's some you can see above the water, but so much more below the surface that you can't see. So when we think about who am I am what you can see above the surface, but I'm also all the things you can't. But when you interact with me, you're interacting with what you can see, also what you can't see. So when you look at me, you might be able to discern my race. You might be able to hear my language. You might be able to see my gender expression, but that's really all you can see. What you don't see is my religion, my values, my sexual orientation, my culture. And those are the things that make up who we are. So if we go to the chat, we can see that there are some things. Jamie says, I'm caring and compassionate. We can't see that about Jamie, but it's so much of who she is. We can't see Trisha's sensitivity, her loyalty. Chris, is it a Christian and a Black nurse for Dr. Lillian Pryor. We can see that Dr. Lillian is African American, but we may not be able to discern that she's Christian unless we take the time and we get to know her and we understand differences, not as a bad thing, but something that it will make us better when we understand the differences and the complexities of all of our identities. Identities are how we relate our experiences to the world we live in. And when we think about that personal identity wheel, it gives us the importance as individuals, and it helps us identify different from others. But when we think about that social identity wheel, it helps us identify as a member of society. And sometimes that can be a little bit challenging to claim, because if an identity is challenging to claim, it's probably an identity where you felt some marginalization, where you felt underrepresented, or society has put you in a box that's not always celebrated. And sometimes we have unearned privilege, and all of us have privilege. Privilege can be education, it can be your race, it can be our wealth. And so we vacillate our privilege and marginalization depending on where we are in society and how we identify. Another foundational term here is equity. And equity is really about having proportional distribution of desired outcomes, making sure that we are providing individuals with what they need to be successful. And it's not determined on their identities, the opportunities that they get or don't get. And so the next image talks about how we sometimes look at equality, equity, and justice together. Sometimes equality and equity are used synonymously, but they are very different things. Equality means giving everyone the same thing. So if you look at the first image, everyone has a box, but it's barely helping the second person look over the gate, and it's not helping the third person look over the gate at all. And the first person didn't need a box to see over the gate in the first place. But when we think about equity, giving people what they need to be successful, we don't give the taller person a box because they can see over the gate without it. The second person gets one box and it still adjusts their height so they can see over the gate. And then the third person gets two boxes so they can see over the fence and to be able to enjoy the ball game. Well, when we think about the next step, it's justice. We should remove the fence. And so that's really talking about how we interact with our systems. So, looking at systems to see if they are embedded in standards of equity, making sure that everyone has the resources, the support, the care that they need to be well and to find life, liberty, and happiness, right? Um, Justice is really about helping us usher in or shepherd in accountability for equity. We really have these terms of equity, and we want to be equitable in our care, health equity, and we want to be equitable in our schools. We want to be equitable in our housing, but we need the justice piece to hold folks accountable. The next term here is belonging. And belonging is really a feeling of security. It's a sense of acceptance for a member of a certain group, and it's a qualitative perspective on inclusion. Belonging does not require us to change who we are. And it's especially important when we think about kidney care teams and professionals. They're often thought of as a second family. So it's really an imperative for patients and families to be who they are. And that is what belonging requires, for us to be who we are. And then when we think about cultural versus structural belonging. Belonging is not only that human emotional need, it's also cultural and structural. It impacts the way we think, the way we feel, and the way we think, and the way we live, depending on our relationships based on our culture. But it's also structural when we think about public systems that ensure people of all backgrounds are not in need of charity or mercy. And the other way to look at structural is if I come into a building and I am a person who uses a wheelchair, but there's not enough elevators or there's not ramps in places so that it cuts off access to where I can go in a building, then the belonging is not there for me. Or if I come into a building and I see your president's wall in a hospital, but there are no people who look like me, then it feels like I don't belong there. And structurally, I haven't been a part of this organization at that level. And so belonging can be cultural and structural as well as emotional. And so we've talked about diversity, equity, diversity, equity, belonging. Now we want to think about inclusion. And it really is that authenticity of bringing all of the different terms together. It's about action. When we think about the dimensions of diversity and that iceberg, we really want to engage with all those different dimensions of diversity. It's doing the work to help individuals feel a part of the process, the activity, and the decision making. Inclusion promotes broad engagement and that shared participation. I feel like I'm a part of this organization because my voice is heard, I'm respected, and I'm valued. Inclusion is really the key to eliminating systemic inequality. So inclusion is really that action piece from all of the other terms that once we understand the differences, once we understand that we're trying to move in a way or have actions and behaviors that are equitable, we want people to belong, then inclusion is really the action that we put toward all of that work. So diversity is a fact. Remember I said it's in the room whether you can see it or whether you can't. Equity is our goal. We want to make sure that we're giving people what they need to be successful. Belonging is our result, and inclusion is a practice that we have to do every day in order to get better at it. I played the violin for 13 years, and my mom used to always say, practice makes perfect. I didn't want to hear it at the time, but truly, the more I practiced, the better I got at the violin. And so that's the same way with inclusion. We have to practice it every day because things are changing. People are different. We're coming across different populations and cultures and beliefs, and we have to practice every day in order to be successful at inclusion. Some critical concepts I want to share here. And the first one is cultural humility. And DEI practitioners have evolved from the philosophy of cultural competency, though some literature lags behind. And in this evolution, we have moved away from cultural competency, which suggests that there's an end point to our learning. We could read a book or take a course or listen to a podcast, and then we know everything we need to know about diversity, equity, and inclusion in different cultures. But we know that's so far from the truth, so we've evolved to a philosophy of cultural humility, which is having a humble and respectful attitude towards individuals of different cultures, realizing we could never know everything about everyone. So we treat it as a lifelong learning goal and process. And then we take it a step further and we strive to be culturally responsive, which is a way of being, excuse me, that allows us to affirm our own culture while positively engaging with others. And we see diversity as a true benefit to us all. Okay, so those are our terms that kind of sets the foundation for diversity, equity, and inclusion work. And when we start to roll out more modules, we'll go back to these terms. And so we really need to have that foundational or common language and understanding. Real and SOGI, there's lots of work being done around real and SOGI in healthcare. First and foremost, it helps us move toward health equity. It gives us qualitative data to help us understand our patient base, and it supports quality of care. And then finally, it's another opportunity to acknowledge the core of inclusion, which is seeing the differences in people. And it requires us to build or improve on people's skills to acknowledge differences, address nuanced needs, and make connections and use our differences to make us better. And so REAL stands for race, ethnicity, and language, and SOGI stands for sexual orientation and gender identity. So first, race. So a lot of times I define race in different settings because people have a different definition of what this is. It's not biological. Race is a social construct, and these categories are assigned to demographic groups based solely on physical characteristics like eye color, hair texture, eye shape, and so those are the physical characteristics that are used to categorize race. Ethnicity are the social characteristics that people have in common, like culture, religion, or food. And then language is something that is very important. And we learned this around COVID when there wasn't enough information out in our communities in the patient's native language. So when we talk about language, we are talking about the communication method that patients choose to discuss their critical healthcare conversations, to have their critical healthcare conversations. And then when we talk about SOGI, sexual orientation, some of these terms are new to some and familiar to others, but we want to make sure that we're going over these terms because, again, we need to understand our patient base and how they identify, and so we can understand the nuances and care needed. Sexual orientation is that romantic or sexual attraction to another. And so when we talk about sexual orientation, we're talking about the heart. Gender identity is how someone wants to be identified or an individual, what they call themselves. And when we talk about gender identity, we're talking about the mind. Sex assigned at birth is the sex that the doctor or midwife assigns to your child at birth based on their external anatomy. And then gender expression, if we go back to the iceberg, it's on top of the water. It's really the only thing you can see. It's how someone chooses to express themselves, usually through body characteristics, voice, or dress. And then cisgender and transgender, we're a binary society. So there was the term transgender, and before we evolved to cisgender, people would say normal. So transgender and normal. But we want to make sure that we understand that both are normal. And cisgender is when your gender identity, remember, is in the mind, aligns with your sex assigned at birth. And transgender is that umbrella term for when your gender expression or gender identity doesn't align with cultural expectations or your sex assigned at birth. And then non-binary and gender non-conforming is when the person doesn't identify as man or woman, so they're not on that binary of cisgender or transgender. Okay, and so here's a helpful resource, and you can Google this, and it'll be in the presentation as well for you to refer back to. But the genderbread person, it helps us kind of visualize what these terms are and what they mean. So again, identity, gender identity is the mind, is who we think we are. Sexual orientation is our attraction, romantically or sexually. So we're talking about the heart. Sex assigned at birth. And then remember, gender expression is really the only thing we can see. Okay. All right. So talking about these different terms, or real and soji, we want to go into an inclusive practice of pronouns, which has been pretty popular in the last couple years because it really is helping us support and affirm our non-binary, gender non-conforming, and trans populations. So pronouns is that inclusive practice that helps us build a welcoming and inclusive space. Pronouns is a way of respecting someone, just like when you would use their proper name in their title. Sharing and using pronouns allows us to normalize this inclusive practice. It helps us avoid assuming, guessing, misgendering, and reinforcing stereotypes. And most importantly, it is about supporting and affirming gender nonconforming and non-binary and trans people. A lot of times I have questions of, well, why, you can see who I am. Why do I need to use it? Maybe they should just use it. But again, it's about being inclusive. We don't want to ostracize anyone and say, well, you all share your pronouns. People can look at me and know my pronouns. It's an inclusive practice where we're all going to share so that we can support and affirm these populations, our populations of trans people, non-binary, and gender non-conforming. There are also a lot of challenges, common challenges that we may see in our hospitals, communities, and organizations that trans people face on a daily basis that we may not even think of. So we think about bathroom access. We take it for granted. I am a female, I can go into the women's bathroom, or male, and I can go into the male bathroom. But that can be a challenge for the trans population. It's also bed coordination we've seen in our hospitals where it can be uncomfortable for the trans patient or for their roommate when they are sent up to a floor that is not how they identify. We've had experiences where the family may complain even if the actual patient doesn't. And so that is another challenge. Dress code can be a challenge, confidentiality, lack of awareness, and also government forms are just now catching up with society. When we think about EEOC forms or Social Security, student financial aid and passport applications. They're just now being inclusive to allow people to identify the way they would like to. Another thing, there are some generational nuances here. We look at, this is the first time that we've had so many generations in the workplace. And as we know, society kind of changes as time goes on. And so when we look at the silent generation, there weren't a lot of people identifying as transgender LGBTQ plus. In the baby boomer generation, there were a few more. Generation X, there were, it continued to grow. There was a spike in the millennial generation, and then it continued to spike in Generation Z. And so we have to understand gender identity and sexual orientation in order to help our patients identify the way they need to identify, for us to understand their needs, and for us to be affirming and welcoming. It's important to ask our patients, how do they want to be identified? Because that generational divide, sometimes baby boomer and silent generation, they still want a handle on their names, right? But that's offensive to Generation X, millennials, and Generation Z when we assume that, I am Mrs. Caldwell. Maybe I'm not. Maybe I just want to use my name, or my pronoun is they. So we really need to understand this population so that we can work with them in order to provide them the best care possible and to welcome them and affirm them in our organizations. Another piece here about pronouns is, on a lot of forms, the governmental forms, like I said, are slow to catch up. There's or we still hear people say, what is your preferred pronoun? But we really shouldn't be saying preferred pronoun. We can prefer a nickname. So if my name is Ricardo, I prefer to be called Ricky. On my pizza, I prefer deep dish rather than thin crust. Or maybe even for cola, I prefer Coke over Pepsi. But we shouldn't use preferred for things that are typically constant, like my height, my pronoun, or my prefix. And so if we should always give our patients and community members and colleagues that opportunity to identify themselves. And one way we can do that is by displaying our pronouns, and I'll talk about that in just a second. DEI is evolving every day, just like the people it seeks to serve. So we will make mistakes. Humans make mistakes all the time. I do this work every day and I still make mistakes. But it's important to be authentic and respectful, and to own our mistakes and take responsibility for our own growth. So a couple best practices when thinking about some of those SOGI terms, pronouns. We really want to be inclusive in everything we do. We want to include pronouns whenever possible on our email, our Zoom, our in our work badges if we can. We want to practice and incorporate gender neutral language. So instead of, hey, you guys, hey, ladies, we want to say, hey, hello, team, or friends, or folks. And then we want to, if we make a mistake, own it, say thank you rather than sorry. And this is something I learned just recently, because when we say sorry, we put the onus on the person to say, oh, that's okay, but it's not okay. So say thank you, and then do the work to move on and course correct as you move forward. And then the last best practice here is to use they and their whenever possible. That gender neutral language is really a way of including everyone in general communication and conversation. So today, a quick summary of what we talked about. We talked about common language, and it's so important to use common language to establish expectations and to begin a dialogue. And I say begin a dialogue because diversity is never one and done. We have to get comfortable with the terms, with the conversation, and with people in order to build that welcoming and inclusive environment. We also need to do some self-reflection to understand where we are on this DEI journey and what is our part in creating that welcoming and inclusive environment. And then understanding that diversity benefits our colleagues, our patients, and our community. And then for further awareness, again, as Dr. Stamps mentioned, this is a DEI series for ANNA. We want you to please sign up for Module 2, Bias, and that is December 5th. And then the best way to learn is to be able to teach someone else. So we encourage you to share what you've learned with coworkers, friends, or family to continue the dialogue. And then we'd love to hear your feedback. It's very valuable to us. And so please participate in the survey that will be sent to you or that is on the ANA platform. So Dr. Stamps, I'm gonna turn it over to you to facilitate questions.
Wonderful. Thank you so much, Dr. Caldwell. It's always a pleasure partnering with you. I always learn something new, expanding my knowledge. I don't
Great.
see any
Thank you.
questions in the Q&A or the chat. I can't imagine there's not one question.
So while we give time for people to ask questions, I want to go back to our who am I? It was some great answers in here. Debbie, she's a survivor, caring, and kind. So none of those things would we see above the iceberg. So it's important to get to know Debbie to know that. Jennifer, strong, intelligent woman. Donna, someone you can count on. Caring, compassionate, caring, and strong. Sensitive, strong, and loyal. Kind-hearted, protector of others, extremely motivated. So thank you so much for participating. And someone else, Deb, you'll remember this from our doctoral days, a servant leader.
Yes.
That is awesome. Thank you so much, Luann. Yes.
Thank
Okay.
you. There are still no questions, but there is one comment. Oh, here we are.
Okay.
We have a couple. All right. We just had to get warmed up. I love it. So from Karen, I found the differences in generations fascinating. Kudos for the younger generations for feeling they can be more transparent about who they are. Absolutely. We're learning a lot from them.
Yes.
And Dr. Lillian Pryor, this was an excellent webinar and gives very foundational information. Thank you. Thank you. Thank you. Will we get the slides? Yes, all of the information will be housed on the ANNA online learning platform, as well as there's some additional resources that you could utilize, like the identity wheel, the social wheel as well. One thing I would like to make sure that everyone knows that's with us today is that we've taken a lens, the DEI committee and the organization, the board, has taken a lens to look at all of our policies through the lens of DEI and inclusion. And so we've actually removed some language from some of our policies. We've added some things to ensure that the policies are inclusive. And when Dr. Caldwell spoke about language, one of the things that we did here at the ANNA is we actually, and it's part of inclusion as well, but we also provided a way for our website to be translated. It's really important so that all people can, regardless of their language, can understand what's on our website. And we also have the accessibility tool for those that need a larger font. For those that need a not so bright background or a brighter background, there's a tool on our website that can actually do that to help you be able to utilize the website with ease. Again, thinking of inclusion and diversity beyond race and ethnicity are my older eyes, more senior eyes, the language that I speak, and so forth.
Dr. Stamps, there's another question here. Any tips for how to be an ally when you observe bias interaction? And so that is something that really takes some work. Um, and so what I can share this with Dr. Stamps and put it up on the website, but it's an ROI model to addressing microaggressions in the workplace. And so taking a different spin on return on investment, you really need to reflect, own your behavior, and whenever possible, be inclusive. And so it really is about understanding the investment that you have to make. Are you capable of it? Are you willing? And what is it going to cost you and the environment? And so there's a couple steps to that plan on how to address biases. Sometimes it really is something that we need to kick up to our HR or to a leader. But I'll give you an example of something I just had from one of the providers in the hospital, where there was a anesthetist that someone asked where the patient was, and the anesthetist told the person who was asking, "Oh, the patient is Black. You can't miss him. He's right in the room." And so the one of the doctors called to say, "Hey, how do I address that?" And I said, "Well, you can do something as simple as saying, let's try to address our patients by name, right?" And so instead of, I don't know if identifying the patient as Black, but if that's all we knew about them and we didn't try to use their name and try to get to know them, then that is something pretty benign that we can do to address that bias interaction. But sometimes bias interactions can get really uh, tumultuous, or it can be volatile. And so you really want to take time to think about, should you be the right one addressing it? And I have another mantra: is it, does it have to be said? Does it have to be said by me? And does it have to be said right now? And so that may be something you want to think through when addressing a bias. And that's not the only way you can be an ally, is by addressing it in real time, right? You can always support someone on the back end as well.
Thank you.
Yep.
Dr. Call, we have another question.
Sure.
When a member shared the DEI webinar on social media, someone responded that DEI was all about allowing meritocracy, giving advantage by race and or color first. How is the best way to explain DEI correctly?
Yeah, and I think Dr. Stamps, you just mentioned it. DEI is so much more than just race, right? We're talking about disabilities, um, uh, visible and invisible disabilities. We're talking about LGBTQ plus. We're talking about gender equity. We're talking about religion. We're talking about body image sometimes. So there's so much more to DEI than just race. And it really is about making systems equitable for everyone. If it works for the most in need, then it will work for everyone. And so that's what DEI is striving to do.
Thank you so much.
Sure.
We have two more that I'd love to address, and then we'll wrap up. Would you recommend changing our signatures on our email to reflect our preferred pronouns?
So I would suggest that you share your pronouns wherever possible. But I also want to reiterate what we talked about a little while ago. It shouldn't be preferred. It should be personal. Remember, when it's a constant, it's not preferred. It is someone's reality. It's not preferred. And so, as long as you understand what sharing your pronouns does as well, because when we share our pronouns, the hope is that someone will see that and feel welcome and say, "Oh, they understand, they're open," and then they'll be more likely to share their pronouns or them parts of themselves with you that they may not share with others. And so, um, that is the responsibility that comes with sharing your pronouns.
Wonderful, wonderful. And again, one more comment. I can't help but think that some who are opposed to DEI don't really understand all it represents. What are your thoughts about this? And the note is, I am not trying to be political in this comment.
Yeah.
I
And
think,
so I totally agree with you. They don't fully understand. Just like the question just a moment ago, it's about making sure that we're equitable and that everyone is able to live their most healthy, most joyful, most prosperous life, right? And so it's not just to take away from one group to give to another, it's about giving and making things better for everyone.
yeah. Well, thank you so much. All of our participants tonight, truly appreciate your comments, you being here with us. This is the beginning of many. Our next session is on bias in December. I think if you could take away something today, is that diversity is the presence of difference, and it includes so much. Zip code, rural, urban, your
Urban.
education, you name it, anything that makes us different. So please, hopefully this will help you to be able to share what DEI is, the importance of inclusion, and we will see you next month. Thank you so much for being with
Thank
us.
you. Thank you,
Thank you.
everyone.
Good night.